Hello, my name is Kate McMahon, and I am your host today for Profile. I'm very excited to share with you one of our two guests from Sharing Kindness. Hi, Kathleen.
Hello, Kate. Thanks for having us.
Yes. So this is Kathleen Shine O'Brien, and she's the Director of Clinical and Community Services at Sharing Kindness.
That's quite a long title, isn't it?
But it sounds like there's some really good stuff that you do there. But before we talk about your title, can you just give us a brief overview regarding Sharing Kindness?
I certainly can. And our executive director in our next program will be telling you a little bit more about it. But I am so grateful that I have been able to be part of Sharing Kindness since its inception in 2018. And I've been part of the growth. I've been part of the listening piece. I've been part of the action. And it has been truly the honor of my professional career to be doing this, and particularly in conjunction with our executive director, Dr. Kim Mead-Walters, who is not just a colleague, but has also become a friend.
Oh, that's wonderful. So back to your title for a second, Director of Clinical and Community Services. Now, I know today specifically we're going to talk about some of the community services, but what about that first part, the clinical
So the clinical
aspect?
piece, I think, is what has set Sharing Kindness apart from other bereavement centers who do grief work and or suicide prevention. And the reason for that is, and I think this really became important to Kim as a medical doctor with 30 plus years of experience being a family doc prior to becoming the full-time executive director of Sharing Kindness, is that we recognize the importance of having a clinical lens, both in our peer grief support groups and in the work that we do in the community. And the reason for that partly is safety for our groups, so that we can provide accurate psychoeducation for our participants, but also making sure that our presentations in the community are well vetted, that they're evidence-based, that they support the research, and we're not just giving opinions, we're giving facts.
That's wonderful. I didn't realize that was part of the mission or part of your responsibilities.
So that is part of my responsibility.
That sounds very important.
Thank you. We think it is. We think it's important. And some of the feedback that we've received from participants who have gone to other organizations in a very constructive way is that when you have clinically led but still peer grief support groups, the lens through which the facilitator sees the group and understands group dynamics is very different from a trained peer facilitator who's running a group by themselves. And that doesn't mean that those don't have value. They have great value. AA is a model that has worked beautifully for decades. But for this specific purpose, for grief support, we feel very strongly and have been applauded by our participants that having this clinical lens has really provided an extra layer of not only safety, but also the importance of confidentiality and maintaining privacy.
Yes, yes, makes sense. Perfect sense. Now, what I've been hearing out and about on Cape Cod is a new program, relatively new, for Sharing Kindness, which is Grief 101. And I mentioned when you arrived here in the studio that I really need to take this or be a participant in this program, because I think I'm not alone in really not knowing what to say and how to deal with a friend who's even dealing with some grief.
That's it. In a nutshell, Kate, that's exactly why we started this program. So when we started, Kim and I started to go out in the community, and initially our focus was suicide prevention. But as we started to go out in the community and hear what people were saying, we kept hearing, there's nobody that can understand my grief. Not suicide specific, but across the board, and also generationally. So we would ask these really important questions like, what was it that you needed? Or what was it that you got that wasn't helpful? What did you receive that was helpful? And as we started to put some of these stories together, it became very clear to us that we live, not just on Cape Cod, but throughout the nation, in an essentially grief illiterate society. And I think part of that is we bring to the table of grief whatever grief biases we have, which essentially began in our family. So if we come from a family where we don't talk about grief, it's a hard conversation to have. Sometimes families remove photographs. Once the person has died, they've died. Other people do celebrations of life continuously. So all of the differences, subtle or not, were becoming very evident to us. So we thought, how could we possibly create a program that would be able to have an impact on our community with regard to grief literacy? And what does that really look like? So the way we broke it down in these presentations is, first of all, a little information about what is grief. It's normal. It's a normal human response to a loss, not necessarily just death, but any loss that we've experienced. So given that, it's pretty unimaginable to think that there would be a human being anywhere that hasn't experienced grief. But maybe they don't call it that. So the loss of a home, the loss of a relationship, the loss of a marriage, moving, even to the point where sometimes exciting changes still have a grief component. So it's really educating about the very basics of what grief is and also what it isn't. And so that's the beginning part of our conversation in these community presentations. And then the very essentials about what can we do? How do we help ourselves? What are the things that are necessary as we navigate grief? Because guess what? There isn't a handbook.
Right.
And we're all individual. And so what feels right for me might not feel right for you. So that's the other part of the normalization that we really want to get across. And a piece of the feedback that we receive consistently is, I'm so grateful for this because I didn't understand how in a family constellation we would be grieving the loss of the same person, and yet the family would be grieving very differently.
Yeah, as individuals.
As individuals. But when we think about it, when that person was alive, we had individual and unique relationships with that person. So it stands to reason that our grief would be unique and individual as well.
Yes.
But those grief biases come in and they think that we should be crying all the time. We shouldn't be engaging in joy. We shouldn't do anything that looks like we're okay when we're not. Or we should be putting a mask on so that everybody thinks that we're okay because nobody really wants to talk about grief.
Talk about it. Yes. Yes. So we talked about the program. Now, where are you actually hosting programs?
So this is the most exciting thing. When Grief 101 began, we received a grant from the network of the National Library of Medicine, which falls under the umbrella of the National Institute of Health. And it was specifically to bring grief literacy to the community. Where best to bring a program like this than a library? That's the safest place in our community.
Yes.
Everybody loves the library. It's very neutral. It's quiet. It's peaceful. It's a safe place to be. So Kim and I decided the best way then to do that was to have a focus group. So we invited librarians from the Mid, Lower, and Outer Cape to kind of work through this with us. And we decided that the focus group was going to turn into a work group because we really needed their expertise. And that was the foundation for this. And boy, has it flown. So our invitation went out to all of the libraries on the Cape and both islands to present Grief 101 in their library at a time that's convenient for them. So some are in the day, some are in the evening, some are on weekends, so that we could attract the largest population of our community that we could.
That's great. That's great. Now, can we take a minute to talk about this? Because this is a leave behind, right? After the presentations at the
So when our
specific
presentation
library?
is complete, it is our pleasure and honor to present the hosting library, usually the children's librarian, with this children's grief backpack. The part of this that is so phenomenal is that these 11 books have been curated by our librarians that were part of our working group. All of them are very newly published. They're not available in the circulation of most libraries. A couple of editions maybe, but they're really new. But the other part is it looks at grief from a child's perspective about pet loss, about grandparent loss, about parent loss, about sibling loss. But it also has books that are culturally relevant, and that's really important. But the piece of this that is so essential to grief literacy is that the books say dead or dying as opposed to benign things. So sometimes kids will say, when my mother said that we've lost my father, I thought, well, we better find him. We then say to the parent, that's why we use actual language.
Yes.
And we explain on a developmentally appropriate level what that actually means. And so these books do just that. And one of the books actually has, in the back of it, sort of a little outline for parents, caregivers, librarians, anybody, for how do we talk about these hard things? How do we use these words and language appropriate to developmental levels, but using the words that the children need to know? They're phenomenal. And in the libraries where we have hosted and the librarians have received these,
Yes.
they're just beside themselves. Now, it
wonderful.
seems a little silly that a librarian would be excited to get a backpack about grief. However, they're the ones that people will go to when someone in the family has died, and they'll say, what do you have in your circulation
yes.
for the children? And
Makes
this now,
sense.
they get to say, here you are, and you're free to check it out.
That's wonderful. And I love that the local librarians curated the books along with you. That's
So again,
wonderful.
we looked at it through the lens of a librarian who's familiar with children and their needs. What makes a good book? What about the illustrations? What about the language? What about the content? So that was theirs, and mine was that clinical lens of, is this appropriate? Are these appropriate words? Is this what we really want the message to be for children and families? And that's why we have these 11 books.
It's wonderful. Absolutely wonderful.
We're thrilled.
Glad it's being so well accepted on our community.
It really is.
That's great. There is another component to Grief 101, which is work in the schools.
So that is the other piece of this program that is so exciting. So in our grief groups that are clinically led, a lot of our clinicians work in schools. They might be guidance counselors, they might be school social workers, school psychologists. And what we were hearing from them is, we have a lot of grieving children in our schools who are unable to come to our in-house, in-person programming in Harwich. What can we do for these children? And we thought, this is really important. We are committed to meeting people where they are, where they're at, in a way that reduces the barriers to be able to access services that are going to help them in their journey. Interestingly, and a little bit of a side note, there is an organization in Colorado that is called the JAG Institute. It's part of Judy's House. And what the JAG Institute does is lots of research about bereavement and statistics on people who are bereaved, particularly children. We paid them, this is how important this was to us, we paid them to do a deep dive into the children's bereavement estimation model for Cape Cod and the islands. What we discovered on the Cape is that through the CDC data that was acquired by JAG Institute, 1 in 9 children on Cape Cod will be bereaved by a parent or a sibling by their 18th birthday.
Oh my.
And that number doubles by the time they're 25. So this is the estimation model based on CDC data. That's a lot of children.
Yes, it is.
In addition, CDC data is only about parents, biological or adoptive parents. We also know that there are many children on the Cape and islands who are being raised in a non-traditional household.
Yes.
And those caregivers also die. But that population isn't included in the data. So we know the 1 in 9 is appropriate, but the numbers are probably a little bit different.
Yes.
And we knew that we weren't attracting the 1 in 9 to our in-house, in-person programming at Harwich. So where do you go? You go to the schools. So when we think about upstream prevention, what we're really doing is we're working with these children to navigate their grief at very young ages, because we also know that unattended grief in children who are bereaved influences their ability to be academically on task. They often have early entrance into the juvenile justice system. They often develop substance use disorders and mental illness themselves. They're at a higher rate of suicide. So we want to be able to get to these children as early as possible so that they feel supported in their grief, and there's a safe place that they can say what they need to say with people who understand. So that was sort of the context of that. The other piece of it is, where do children spend all of their time? In school, with teachers, with the nurses, with administration, with coaches. So what better opportunity to increase grief literacy than to do Grief 101 with the staff in the schools where we're actually doing peer grief support on an in-school basis. So prior to instituting our peer grief support 6-week programs in schools, I do Grief 101 with the school systems in their buildings where we're offering this. So teachers, administrators, coaches, and they get a similar 101 to the communities with a little bit of a bend that's a little bit more about what teachers and administrators can do to support their children. And the interesting part of that is every single time I've done it, I've had people come up to me, whether it be a teacher, guidance counselor, administrator, to say, I thought I was doing the kids a favor, to distract them, to give them a project, to be able to say, hey, look on the bright side, how about this? And I wasn't doing them a favor. I was dismissing where they were. I wasn't being a person that was neutral and not judgmental, but their hearts were all in the right place.
Exactly. They thought they were doing the right thing.
Absolutely. So these projects that we're doing, both in the community and in schools, have just incredible value to everybody.
Yes, yes. Because as we talked about early on, it's a subject that we just don't pay attention to. And that is in our culture, because we're just supposed to always be strong and moving forward.
Yes, and so we have also these myths that we buy into, right? So if I'm newly bereaved and I come back to work and somebody says, Kathleen, how are you? Do I tell them the truth?
Yeah.
Do I say, whew, bad morning, barely got myself here? Or do I say, okay, thanks for asking, I'm fine.
Right.
And then you say to other people that we work with, hey, she's great. She's great. I talked to her this morning, she's fine. And everybody wants me to be fine because nobody is comfortable bearing witness to profound grief and loss. So we all wear masks as bereaved people, but it doesn't do justice to the experience we have. And so that's the important part of this. So the other part of this Grief 101 is not just taking care of ourselves as bereaved people, but then as companions, as co-workers, as family members, as neighbors. What can I do to companion my friend, my family member, my colleague in their grief journey for which there is no handbook?
And it's probably also included in the program, what do I say? How do I say it?
So I'll give you an example that is brilliant. We often are conditioned, again, by our grief biases and also by our direction to try to make people feel better. We call it toxic positivity. It's to look at the bright side. What's the silver lining? But what I hear... It could be worse. It could be worse. At least you have other children. At least you can get pregnant again. Maybe you'll find somebody new. And what does that do to the bereaved person? It makes them feel more marginalized, more isolated, and very unsafe to have real hard conversations with that person. Also, there's that possibility, unintentionally and certainly well-meaning, hijacking somebody's grief. So what that would look like is, I say to you, my husband died 2 weeks ago. And you say, oh my gosh, I know exactly what you're going through. When I was 16, my grandmother died.
Right.
And again,
grief.
In well-meaning ways, you're trying to align yourself saying, I know. But we know that everybody's experience is so unique, and losing a spouse or a child or a sibling is different from losing a grandparent. And there are also deaths that are out of order deaths. Certainly losing a child is a significant out of order death that completely changes our assumptive worldview.
Yes,
we cannot hijack someone's grief when it comes to the death of a child. That is very unique. We also have stigmatized deaths. So I include in that deaths by suicide, deaths by drug overdose, and deaths by homicide. And often those are the folks that want so much support, if just for someone to sit with them and to tend to them in these unspeakable moments. But people tend to shy away from that. because of the stigma that surrounds those kinds of deaths. So it complicates bereavement in ways that are just unimaginable.
Yes, yes. Wow, you all are doing amazing work for folks on the Cape and our two islands. It's wonderful.
Thank you.
Absolutely wonderful. Is there anything else that you would like to share regarding the impact or anything else we've missed to talk about today?
I think I just want to reiterate that it is important across the lifespan that we talk about this, that we talk about it in ways that are honest. We call it courageous conversation. They're not easy conversations to have. We will get emotional. We will get that catch in our throat, and that's okay.
It's okay.
That's normal. And especially when an adult gets that way in speaking with a child, as we then recover and say, okay, I can finish this conversation. What a beautiful example we give to the children when they also feel those big emotions that they don't feel comfortable sharing. And the other part of it is we talk about tears being liquid love.
I love that.
And so we don't apologize for laughing, do we? No. Why do we apologize for crying? Again, we normalize these experiences for everybody so that we can have these courageous conversations around grief and mourning.
Thank you so much for being here today.
Thank you for having us.
I learned so much, and thank you so much for what you do.
You are very welcome. It's our pleasure.
And I'm Kate McMahon, and thank you for joining us for Profile.